Some people, you can tell that they've gotten too much plastic surgery, and I think that's when plastic surgeons should step in and be honest and open with their patients and think about their patient's health more than their health of their wallet.
100%, he's absolutely right here. Hey guys, Dr. Gary Linkov here of City Facial Plastics in New York City. As you guys know, I'm a facial plastic surgeon and a hair restoration surgeon. Today, I wanted to do a reaction video to Dr. Mike's comments on plastic surgery. So Dr. Mike is sort of a staple in this kind of local New York community as well as worldwide. I mean, he's really gotten quite big, so definitely respect everything that he's done. We have like a similar cultural background, which is pretty cool. I've enjoyed watching him get more and more popular, and I think he's doing great work. So here he is commenting on plastic surgery. I'm going to watch this and give you some of my thoughts on what I think he says.
What is your opinion on cosmetic plastic surgery? Lauren, I know some people aren't happy with the appearance that they're born with, and it's totally understandable.
I mean, definitely people are bothered by how they look as far as, cosmetic plastic surgery is concerned. Some people look for solutions, and sometimes, it's something that's bothered them for their whole life, and other times, they sustained an accident of some kind, and now there's some sort of disfigurement or something that they really don't like, that they want to reverse back to how they looked before. But other times people just want, to tweak something that they feel like they weren't born looking exactly how they would like to look, or not quite like what the standard beauty is in society today, and they're looking to make changes to get closer to some sort of an ideal. Those are some of the reasons why people choose to get surgery.
I'm not totally against it. I think there are instances where people get addicted to it, and I think that plastic surgeons could do a better job of screening this out.
Really good point. There are people who are addicted to cosmetic surgery. Some folks feel that they can just kind of fix everything about themselves with a knife, and then they're going to all of a sudden feel so much better about who they are. And that's oftentimes not the case. Most of my patients are coming to me for like a specific issue or perceived issue. They're not necessarily saying, I want a complete overhaul and I want this and I want that. Whenever I talk to a person who wants many, many different things, I get a little bit concerned about exactly what Dr. Mike is talking about. In terms of screening patients, that's a little bit harder, right? Because there are some surgeons who will give questionnaires. There's some research in our field, in the whole kind of plastic surgery community, about what screening devices you can use to try to kind of feel out if a person is really a great candidate for a surgery, or if maybe surgery is not the right answer for them. It becomes a little bit difficult from a just practical standpoint. I can tell you, just by having a practice, we have people who call in, they have consultations. If you start putting up a barrier such as like, oh, now you have to fill out a screening questionnaire, it can turn some people off, and some people get offended. Some people can get insulted that, well, what does he think, I'm crazy? Like, does the doctor really not believe me? Sometimes we walk like a fine line there, and it's not so easy to screen people, but my antenna is always up. Most importantly, it's to protect the patient and not let them get a surgery that's really not the right thing for them, or might potentially hurt them, or something that they really won't be happy with. The whole point of doing these surgeries, especially when it comes to cosmetic surgery, is for the person to be happier afterwards.
I'm not saying they have to be diagnosed with body dysmorphia disorder.
And that's one of the most common diagnoses of patients who really do get a lot of plastic surgery and really should be told by doctors not to have any more surgery.
You can tell that they've gotten too much plastic surgery, and I think that's when plastic surgeons should step in and be honest and open with their patients and think about their patient's health more than their health of their wallet.
100%, he's absolutely right here. Again, you have to keep the patient front and center. When you start getting concerned about how much money you're making,
tell them to bring me my money.
Can I just do another surgery to make myself feel better, or to put it up on Instagram or something like that? That's when you get into a lot of problems. So the best type of patient is someone who's very grounded, in a good state of mind, if they have the type of physical concern that matches with what myself as a surgeon sees as something that can be fixed or adjusted. That's the best type of patient, not someone who's coming into it with, lots of emotional baggage and issues and very minor irregularities or something that bothers them. You have to be able to accept the risks when going under, and also you need to, as a surgeon, I need to be able to trust that I can work with the patient after surgery if there is a problem that emerges.
That's me being a little preachy, but if whatever procedure you want to have is important to you and it's causing the disfigurement or whatever you're upset about is causing you significant distress, then you weigh the harms of that distress versus the possible harms of that surgery and the benefits of removing those feelings, and you make a decision that's a personalized one for yourself.
Yeah, I couldn't agree with him more. It's just a risk-benefit analysis every time, and you need to be in a good state of mind to process all that information, and you need to be with a surgeon who you trust and can be honest about the procedure that you're going to be going for and what a realistic outcome can look like for you.
Remember, plastic surgery is also pretty expensive and not covered by insurance.
Well, there are certain functional surgeries that are covered by insurance, but then there are also some doctors like myself that doesn't participate with in-network insurance, so you have to be careful. If you are interested in using your insurance to cover some of the costs of your plastic surgery, definitely have that discussion up front with your doctor, and usually there are certain ways you can make that work if it's for a specific kind of plastic surgery that's for more functional purposes and not just for cosmetic. A great analysis by Dr. Mike. Let me know what you guys think in the comments below, and hopefully I'll be able to get on live with Dr. Mike one of these days, and I'd love to talk to him about my hair restoration work and other things related to what I do. It'd be great to get his feedback. All the best, guys. Have a good day and talk soon.